Ooh. Okay, one sec. We are turning on Facebook. Give me one quick moment here. All right. Hello, YouTube. Sorry. Always details. Oh, okay. Let's see. Can I just move this over here a little bit? Okay. Let's see if we can get Facebook started. Today is just one of those days. Ow. Yes, we are live on Facebook and we are live on YouTube. Hello, my friends. Jill Osborne from the Interstitial Cystitis Network. It is Sunday, June 15th of 2025, and it is Father's Day. Happy Heavenly Father's Day, Dad. Thank you for helping me start the IC Network and keep it going for so long. We love our dads very, 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 very much. So to the men out there who are struggling with pelvic pain or struggling with IC, struggling with prostatitis, who are valiantly working even though they are in pain and discomfort, who are struggling to find health care, who may or may not have family that support them to the degree that they deserve, we're here for you. I see you. I hear you. And believe it or not, I talk to men almost every day who have this. You are not alone, my friends. You are not alone. Okay, so it has been a very, very, very big week in the IC and pelvic pain world. We just finished our 2-day International Pelvic Pain Society conference. It was, as always, phenomenal. I'm telling you right now, that's where I get most of my information is from the International Pelvic Pain Society. I think that they are amazing in helping us understand the diversity of conditions that can lead to the pain and the bladder symptoms that we're struggling. We are absolutely not all the same, not at all. So I've got a really cool app I'm going to share with all of you in a moment. We are going to talk yet again about the Elmiron expose. Normally when I do these meetings, I do a little 30-minute intro and then I'm happy to take your questions. As long as you have questions, I will be here. Sometimes our meetings last 5 hours, sometimes they'll last 90 minutes. All entirely up to you. Anne said, not thrilled with my pelvic floor therapist. She hurt. Is she supposed to and told me to use a dilator instead of a wand? Well, honey, it really depends upon what we're struggling with right now. If your muscles are really locked down very, 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 very tight, yeah, starting out with a dilator so that you can gradually help these muscles open and relax and release is absolutely the right thing to do. So just, it's give and take. They've got to understand your body. You've got to learn from them. In the end, you're the boss, but they're the ones who have to teach you and guide you. And if she's saying you've got to use a dilator, then you've got to ask her why. Lori says, I think my magazine is going to my old email address. How can I give you my new email address? Lori, all you have to do is log into your member page. If you just log into your member page, you can download it. If you go over to the icnsales.com and just log into your member page and go to your actual member publication page, it's right there. You can download it right there. Okay, so we are going to start with hello, it's done. What have I been talking about for the last 4 to 5 months? I have been rewriting our IC flare management guide. And I hadn't done it in 15 years, because back when we wrote it, we all assumed that IC was a bladder disease with a little bit of pelvic floor stuff going in. Now we know that there's lots of different types of flares, lots of things that can cause different flares. And I poured my heart and soul into trying to create a new flare management guide that I truly hope will help you understand what causes flares, what their common triggers are, what based upon your phenotype, what kind of flares are you going to be the most at risk of, and even more importantly, rescue plans. What can we do to rescue you out of a flare? So we're doing two versions of this. So this is our magazine, the IC Optimist. This is our patient magazine. This is how we released the last one. Okay, and so our members already, if you haven't gotten it yet, it is in the mail to you right now. If you get it as a PDF file, you just log into your member page. Any member can log into your member page and read it right there in the IC Network shop. And please know that it costs $25 to read it by email and online. And this is how we support our work. So literally, we're here today because we have people who believe in us. So let's just kind of go through what I've got in this, because I wanted to show this to you. So I always include in our magazine an affirmation page, because I think we get so caught up in the day-to-day stress and frustration of life and of dealing with bladder symptoms. Something that is quite calming and soothing, I think, is important. And ironically, and I'm going to talk about this when I talk about the International Pelvic Pain Society meeting, this is a critical trend now that we're needing to calm our central nervous system. My first section is understanding IC flares. We, give you that basics, what causes a flare or what is a flare. As I say here, this guide is all about flares, those sudden moments when our symptoms get inexplicably worse. Many IC patients have found themselves frustrated by the fact that flares keep happening. This guide will answer many of your questions, including why flares happen, how you can treat them at home, when to call your doctor, and most importantly, how to prevent them from happening in the first place. When a flare strikes, your job is to identify the underlying cause of that flare so that it can be treated correctly. A one treatment fits all approach, such as allo, azo, antibiotics, does not work for flares. Why? Because there are many different types. Driving in a car, intimacy could trigger a pelvic flare, while drinking coffee can trigger a bladder wall flare. This guide takes it one step further and looks at stress-induced flares, menstrual flares, urethral flares, pudendal neuralgia flares, and more. My goal is to give you more control over your symptoms with a thorough discussion of their triggers and rescue plans. And what's different about this is you're going to see a picture of a redhead if you read it online. And that's where I'm talking specifically. There are things that are very important for me to share with you and or pieces of my story. So here, hold on a sec. I just there's so much I want to show you. So we have a whole section on bladder wall flares. So the most common IC flare is undeniably a bladder wall flare. I had no idea that the bladder could cause such agonizing pain until it happened to me at the age of 32. It felt like the world's worst bladder infection, and yet, like so many of you, I was stunned when urine tests found no infection. The origins of my IC go back to a pelvic injury during childhood. With pelvic muscles as tight as a drum, it's no wonder that my bladder health was declining. It just wasn't getting enough blood supply to be healthy. And you're going to notice I've got risk factors, triggers, and then we have our rescue plans, what to do in the first hour, what to do in the second hour, and then what to do long term. Okay, hold on. It gets better. Pelvic floor flare. So here's our pelvic floor flare. My little intro is when my urinary symptoms began at 13, we all thought I had a UTI. Yet there was another unusual clue. My urethra was very narrow. So much so that they regularly performed urethral dilations to open it up. Not once, however, did anyone ask why. It took 30 years to learn the answer. My pelvic floor muscles were extremely tight, probably the result of me falling and breaking my tailbone that year. This also explained why I had a normal, healthy bladder every time I had a cystoscopy. Bladder therapies are also never worked for me. Pelvic floor physical therapy, in contrast, helped and continues to help tremendously. What makes this cool is for the first time, look at this. We have the stretches that you can do to relax your pelvic floor. I'm so proud of this. See this? Because so many of you ask, what can I do to relax my muscles? Well, there you go, my friends. And by the way, the whole stretching protocol is free on our website. Debbie says she's looking. Girl, we'll talk about that. All right. Our third flare that we've never talked about is the pelvic neuralgia flare. And again, you can see triggers, rescue, etc. As I'm writing this, I have pain in my left sit bone and a strong vibration in my left glute. All signs of a pudendal nerve entrapment. It began in my 30s after I sat on a hard chair for about 12 hours while working. Like a fool, I ignored it until it became so violent that I couldn't sit at all. This resulted in a severe nerve injury that 20 years later still haunts me if I sit or drive for long periods of time. If I sleep in the wrong position, the vibration can wake me up and literally shake me the entire time. It's actually vibrating right now as I'm sitting here. So we have the whole neuralgia thing. Our next flare is the stress flare. What do we do with the stress flare? Because we now understand very clearly that the stress flare is all about a central nervous system stuck in fight or flight. That when you are in periods of very, very intense stress, when you are enduring something difficult, your sympathetic nervous system takes over your brain, and that amplifies the pain. And that also tightens pelvic floor muscles and raises your heart rate, raises your blood pressure. And so in this section, I talk a lot about how to get your brain out of fight or flight. And again, it's just such a theme at the International Pelvic Pain Society meeting this weekend. Like, I was just listening to them in awe. I want to talk about it, but I got to do it all in order. Okay, the next flare is our menstrual flare. Because hello, some of you do flare the day that you ovulate and a couple of days before your period. I certainly did. As estrogen levels fluctuate, so too can our pelvic pain. It's quite normal for women to flare the day that they ovulate, as well as a day or two before their period. Women going through perimenopause may suffer more frequent periods and very heavy flows for a couple of days. Thankfully, after menopause, these symptoms stabilize. But then women face a new challenge, estrogen atrophy, which can also cause bladder, urethral, and pelvic pain. Okay. And again, for the first time, we have the urethral flare. What can we do to calm that urethra when our urethra starts screaming in pain? The urethra might seem innocuous, but it can produce intense, very sharp, and sometimes agonizing pain. This small tube does not like to be poked, prodded, or stretched, such as during catheterization or bladder treatment. It can be irritated by chemicals such as bubble baths, spermicide, soaps, fabric softeners, laundry detergent, sex, infections, and even sitting on a bicycle or riding a horse. As I got a wee bit older, I learned another common trigger, estrogen atrophy. For men, urethral pain is far more complex because their urethra is much longer and passes through the prostate. Benign prostate hyperplasia can reduce urine flow, triggering pain and discomfort as well. Your job is to try to understand what is causing your urethra to hurt so badly to help those tissues calm down. And then we have the vulvadenia flare. Have you ever felt like you had a bad yeast infection, but the doctor finds no sign of yeast? That was me while I was in high school and college. At least once a month, I had to use Monistat cream to soothe a vulva and vagina that felt like they were on fire. There were moments when I couldn't even wear underwear. Today, we now know that this is often the result of tight muscles squeezing the pudendal nerve, but it can also occur with estrogen atrophy, yeast or viral infections, your irritation from chemicals, and even menstrual pads. Bubble baths and bath bombs can be very irritating as well. As a teen, my worst pain was on my perineum, that little bit of skin between the vulva and the rectum. Felt like the skin had been scrubbed off with sandpaper. A good anatomy book introduced me to a structure called the perineal body. It's an attachment point for pelvic floor muscles directly under the skin of the perineum. If it's pulled and stressed, perineal pain is the result. Today, I now believe that those vulvadenia flares were pelvic floor driven. I wasted thousands of dollars trying yeast therapies that had no chance of success. Pelvic floor therapy, on the other hand, helped tremendously. Anyway, so again, we talk about triggers, we offer rescue plans, and the different medications and stuff that you can use. And then, listen, when you're a kid in your 20s, you don't want to talk about this stuff. But once you've gotten to a certain age, you realize everybody at some point in time has had tush pain. And so it's about time we start talking about how can we soothe rectal pain, because rectal pain is actually really common in the IC patients. So there's nothing more frustrating than a throbbing, painful rectum. For the IC patient, the first suspect to consider is a simple hemorrhoid. These swollen and inflamed veins emerge around and inside the anus while straining to have a bowel movement, and for young mothers straining to bear a child. Given the fact that many ICers struggle with constipation and have been known to strain to push urine out, hemorrhoids can easily occur. Push too hard, you can even develop a tear in the tissue known as an anal fissure. If you feel pressure inside your anus, this means that you could have some swelling internally or perhaps be very constipated with hardened poop stuck within. Amen. We've all been there. Remember, a normal bowel movement is soft and long. If you're passing hard mumbo like poops, that's a sign of dehydration and chronic constipation. Anyway, there's a lot more here. Triggers, rescue plan. And then we have the sex flare, how to handle flares from sex. And our last flare is the allergy flare, because we certainly know it's quite common for IC symptoms to flare during allergy season, especially in patients who already have a history of hay fever and allergies. Allergenic flares are essentially bladder wall flares caused by mast cells releasing histamine. And then we go through the common things for that. And so it's done. Praise God, it's done. I'm so happy that we now have this new resource. Now, I am going to tell you, our book, IC 101, and our masterclass, IC 101. So we're doing a lot more videos on each one of these flares for our masterclass, which is free on our website, by the way. I am going to have a much longer flare management guide called the IC 101 Flare Guide to Managing Flares. That's going to include a bunch of articles in it too. And so that we're working on right now. Hopefully that will be done in a month or so. And then that's going to be part of our whole IC 101 series. Cool? I hope it really helps. I really, really, truly hope that it helps you. Okay. And hey, by the way, you guys, how is the sound on YouTube? Are you okay sound-wise? Because last week you had an echo. I'm hoping it's better this week. Now, the other big thing, if you watched last week, we talked about this brand new investigative report that was done by a publication called The Lever. This is associated with CUNY School of Journalism. The authors of the report are authors who um, oh, how do I want to say this? Are trying to bring awareness about flaws in the way drugs are approved and in the way medical devices are approved. And in this case, they're discussing how medications now are being approved by the FDA with little, if any, evidence that they work. Hundreds, over 400 medications were approved basically in the last 15 years on this kind of accelerated, streamlined pathway. And unfortunately, that pathway um, uh, does not require the vigorous research that we used to have proving that a product is safe and effective. Um, this is happening quite commonly with new cancer medication, where it gets approved, the company promises to do a follow-up study. Sometimes the follow-up studies aren't done, sometimes they're not done in a timely manner. But what's amazing is when a follow-up study comes back and shows the medication does not work, the product does not really get pulled from the market. It's still out there, but it does not work. Simply does not work. A lot of medications are like that. So I said last week that I was going to do this very, very comprehensive article, which I finished last night, and it is now up on our website. So that you can see how and why they have profiled Elmiron as the perfect example of a medication which was approved without really good, rigorous data. And the flaw now is that we have many patients who are struggling with retinal damage. Some of those patients are now completely blind. Some of these patients have had to have their bowels removed because they have inflammatory bowel disorder or disease, which we've now also associated with Elmiron use. And it really raises the question, if you had had this data, if we had had this data in 1996, and we knew in 1996 it did not work because Elmiron was approved in 1996. They did not do the follow-up study for 18 freaking years. So for 18 years, Elmiron was on the market, and it was given to hundreds of thousands of patients according to the Lever report. So they threw it into the wild. Company making lots of money, obviously. It took them 18 years to finally do the follow-up study that the FDA was asking for in 1996. And you know what that showed? Didn't work. No better than placebo. And we really have to think about this for a moment, because when you're told, hey, this is FDA approved for IC, you assume it's safe. You assume that all that research has been done, right? But as this investigative report shows, it wasn't done. And the FDA saw flaws in the first two studies. The most biggest flaw that the FDA staff harped on is, hey, in the study you've given us, only one doctor showing success. The doctor who owned the patent. All the other doctors did not show success. And the FDA found that quite concerning. That only one doctor apparently could use it and get success. All the other doctors, no, didn't get good results at all. So the FDA, during that approval process, kept saying, please, please do another study. And the Baker Norton was saying, no, we don't want to do another study. Let's just look at the data in a different way. And the FDA denied them twice and said, no, this isn't good enough. And then inexplicably, it got approved based upon what we call compassionate use data. And that means that they get for about 9 years before it was FDA approved, before we had any good studies, they were giving it out to patients anyway. So anyway, over on the IC Network website, I have completed this huge blog. I've got all the dates, all the times uh, of how it was used, or how it went through the FDA approval process, what the FDA said back to them and requested of them. And then I give the safety data for the eye issues, and then I give the safety data for the bowel issues. And then in the end, the question is, who is responsible? If you look at the FDA data, the FAERS data, the adverse event data that was filed showing that there were more than 5,000 adverse event reports associated with Elmiron. There were over 40 fatalities associated with Elmiron. There were 3,000 reports of patients who had eye disease. There were like over 800 reports of patients who had bowel disorders. Whose responsibility was it to monitor this data and do additional investigation? That's the question. The problem with our FDA reporting system is, yeah, you can file a report, but do they act on it? No, not really. It's really rare that they would act. And we've seen that with the hundreds and thousands of reports in the MedWatch database or the MOD database with respect to Interstone. So hopefully you would think then that the manufacturer of the medication actually is monitoring safety data. Did they? I don't know if they did or not. What we know is that they're settling lots and lots of lawsuits for 6 figures. So anyway, this is probably going to be the final thing that I ever write on Elmiron. And it's right on our website for anybody who wants to go see that. Donna said, I got a reaction for 25 milligrams hydroxypamoate. You mentioned it's easier to take than hydroxyzine hydrochloride. It comes in capsules. Can it be divided in half? Well, that's what my doctor had me do. He had me open up the capsule and kind of just pour half of the medication on one side, half on the other. And then I just swallowed one, save the other for the next night. Or the other thing they said to do is you can put it in a half a cup of water, stir it up, get a good solution, pour out a quarter cup, drink the quarter cup, put the other in your refrigerator, and you can drink it the next night. I mean, that's what my doctors had me do. But something new might have happened. You can ask your pharmacist what your pharmacist would say on that too. The challenge with hydroxyzine is that it's not water soluble. So when you put it in water, it's still gonna be powder. So you really have to stir it up, get a really, really good solution, and then immediately pour it out before it starts settling. So you get a good distribution of the medication in each section of water. Rebecca says, thank you for my supplements goodies. You are appreciated. You're welcome. And you can find the stretches over on the IC Network website in our free download area. It is a two-sided page there where you can just print it out and you can have those, or you can get the flare management guide. It's right now, again, your members already have it. It is available for sale. You can get an e-version for, I don't know, I think it's like $4.99, $5.99, something like that, or you can get a print version. Our big issue is the cost of paper has gone up massively, and the cost of postage. So literally, I think we sell the print version for like $8.99 or something, and it costs us like $8.50 to print it and mail it. So this is not a moneymaker for us at all. Donna says, I used to do this with Prozac. I will try that with Pamoate. Worth a shot, honey. And remember with Pamoate, with the hydroxyzines, it can be sedating. And so best time to take it, at least in my experience, and I took it for a good 7-8 years, was right after dinner. If you take it before you go to bed, the problem is it's a little bit harder to wake up in the morning, and that's challenging. It's easier if you take it, um, easier to wake up if you take it around dinner time. So, okay. Hello, Danielle. Sound is good. Excellent. I'm glad it's working. Um, so. I attended the International Pelvic Pain Society meeting. We had our last session yesterday, and um, a dominant theme now as we ponder chronic pelvic pain, or we ponder chronic overlapping pain conditions. Those of us who have multiple pain conditions, we got the IC and the IBS, or the vulvadenia, or the TMJ, or the migraines, or the fibro. Patients who have that also tend to have very sensitive skin and a wicked sense of smell. What does that mean? When you get really sensitive skin, you got a wicked sense of smell. What that tells us is that your central nervous system is involved in this process. That yes, you're having bladder pain and bowel pain, but it's really not a bladder or bowel disorder as much as it is a central nervous system injury/trauma. The blessing of that is that it takes all the shame away. When you actually meet other patients who have multiple pain conditions, you come to realize that we're all just normal people who just had something happen to us. A common theme in my office is if you grew up in the home of an alcoholic, if you suffered a major physical injury, being hit by a car, breaking a leg, something like that. We know that 80% of the children who go on to develop widespread pain as an adult tend to have a major physical injury that happened at some point in time. For the other 20%, again, it's usually a history of abuse or bullying. The marker for this widespread pain syndrome that tells me that this is going on are those patients who struggle with anxiety disorder. Anxiety disorder, it affects about 40% of the IC patient population, and anxiety disorder is a harbinger of widespread pain. Anxiety disorder means that we've got a central nervous system that is literally feels unsafe. It is stuck in fight or flight. As I have shared before, I was attacked when I was quite young, 4th grade, by a young man who later became a rapist and murderer. I did not leave my home without fear for a decade. You better damn well believe I was in fight or flight legitimately. I ran to school as fast as I could, and I ran home as fast as I could because I never knew when I was going to get jumped. And I was jumped many times. That trained my brain to be very, very vigilant. So that is stunningly common. Every single day when I do patient coaching, I find at least 1 or 2 people whose story matches my story. And on Friday, I swear I met my twin. We were identical in in the painful conditions we had, in our histories. Only in her case, she suffered abuse at home. But here it is 50 years later, still scared. That child's brain has become programmed by recurrent, persistent stress to protect you. I have shared many times. I've never taken a vacation where I've enjoyed the vacation. I spend the whole time going, I need to get home. I need to get home. That's my brain saying you're safe at home. And I've done trauma therapy now, and I can't wait to take my next vacation because I really think we've made progress on that. So anyway, I have to rewatch a bunch of sessions. I always listen to them first, watch them first, get the gist of them, and then I have to go back and rewatch them again so that I can write an article on it and really do the details. But safety, what everybody was saying, all the top pelvic pain doctors in the world, is the way we turn off chronic pain is by getting the brain to perceive that we are in fact safe, that we're not unsafe, that we have a sense of safety, that we have a sense of security. It's weird. It's really weird that something that happened in childhood can still make you feel unsafe in your 50s and 60s. But that's just the way the brain works. So anyway, they were talking about sound therapy, looking for ways that we can turn off fight or flight. And there was a researcher there who developed an app called Apollo. It's called Apollo Good Vibrations. And it's free, guys. It's free. And so what it is it makes your phone vibrate for 2 minutes at a time in a very specific way that is equivalent to receiving a hug. It has the exact same reaction in the brain. How do we get security? We get security with touch. We get security with sound, the sound of our mom, the sound of our dad. And so this is combining both of those. So it's called, again, Apollo Good Vibes. And so here we're listening to this lecture, this incredible presentation. There's a massive amount of research showing that this works. Lots and lots and lots of studies showing that this technique actually works. And they have a wearable bracelet that you can wear on your arm, on your foot, etc. But it's a little expensive. People can't afford that. And so a couple of months ago, they created a free version for a phone, and it makes your phone vibrate. So that's the little app, and you can control the intensity with this line, and you just go for 2 minutes. And so you're probably not even gonna hear this. Can you hear that? It is just a very light vibration, no adverse events. I specifically asked that question. And what was fascinating to me is that I was holding it in my hand, and after about a minute, I felt so calm. It's the strangest thing that a vibration can change the way your central nervous system is operating. But it does. I'm doing it right now, and it feels wonderful. So when we talk about how do we break a stress-induced flare, this is one way of directly calming your central nervous system down and getting it out of fight or flight and getting it back into that calm, lower blood pressure, lower heart rate, less stress. So anyway, Apollo Good Vibes app, it's not on Android yet. At least I don't think it is. It's on iPhones right now. I say, why not give it a try? Why not give it a try? Sometimes they say you can put it on your chest, And I can imagine that that would be, like my favorite memory, childhood memory of my mother was was resting against her chest in church when I was maybe 4 years old, and I had my ear on her chest wall, and I could hear her singing, and it was a vibration. See, it stopped because it only goes for 2 minutes. Um, and that's what this is like. It's like listening to the voice of somebody that you love. It's like that deep vibration you get. So, anyway, it's cool. It's very, very cool. Now, with respect to adverse events, um, the one thing he said is that if you have it on for a long, long, long period of time, it can be overstimulating. The same is true if you're listening to music and you listen to loud music for a very long period of time. It's just kind of disorienting to your nervous system, and you have to turn it off and you have to step away. And the same is true for this. If you've got it on for hours, then there's going to come a point in time where your nervous system is going to say, "Okay, you can back off, leave me alone for a while." So that was very, very cool. Let me see. I also took some screenshots. Hold on a sec. Let me just look at some of the screenshots I took. They had one of the best psychologists in the world. His name is Charlie Curtis. He's a board certified hypnotherapist. He's an expert at stress reduction, neuro-linguistic programming, emotional freedom techniques. And his presentation was off the charts, so incredibly good, because again, nobody is saying this is all in your head. Nobody is saying that this is mental illness at all. This is really just a trauma response. And if we recognize the trauma response for what it is, we then can reprogram that brain out of that trauma response, get you out of fight or flight, which will then calm a lot of this pain down and a lot of this sensitivity down. So for that widespread pain group, lots of really good new things happening. Let's see. Jason Kutch, who's a researcher at USC, gave a fantastic presentation on how, we like to think that, oh yeah, this is the other big thing, kind of around muscle tension and trigger points. The assumption here is that the reason why you have pelvic floor tension or trigger points is because at some point in time you suffered an injury, and that certainly is the case. But we also have new research which is showing that sometimes it's the central nervous system that is triggering the development of painful trigger points. And it's the central nervous system that is playing a bigger role in our symptoms than we originally thought. Let's see, hold on. Let me look at a couple more of these screenshots that I took. There's likely a mechanism in the connectivity between the brain and pelvic floor in men with chronic prostatitis or CPPS that prevents relaxation after a brain signaled pelvic floor contraction. Relaxation training oriented towards specific activities that engage the pelvic floor muscle should be explored as a potential alternative to a more global systemic. Okay, so in other words, they were measuring how muscles respond in tension, relaxation, tension, relaxation, tension, relaxation. Patients with pelvic pain were very, very different than patients without pelvic pain. And now they're trying to understand that difference a little bit more. And that there does appear to be a nerve sensory processing issue going on. Again, probably related to an old big time injury or related to the fact that we've got a brain again, that's just very hypervigilant from a past trauma. You know what they talked about? They talked about it. The guy talked about it about, um, when you drive a car off road and you've got tire tracks. And so you've got tire tracks that show areas basically of damage. I mean, this is a pathway that has been followed before. This is an injury that has been followed before. And they were kind of using that as an example to explain kind of the spinal cord after injury, that when we have a patient who has sustained trauma of some type, the spinal cord and the central nervous system itself now has tracks in it that can be easily stimulated on again if something else happens. I know I'm not saying it well. Again, I'm going to watch everything again. I'm going to create an article on it and probably a video on it too. I'm just giving you my impressions here. The more we practice thinking, perceiving, and doing anything, the better we get at it. This occurs because our neurons make new proteins that increase the strength and efficiency of neural connections. These evolutionarily conserved mechanisms of learning date back 300 million years. So the more we practice thinking and perceiving and doing anything, the better we get at it. Charlie, the expert at getting a brain out of fight or flight, was raving about the critical importance and effectiveness of just journaling. He was talking about how, okay, I want to say this the right way. When you have chronic pain, when you have systemic pain, it's really hard to find happiness. That when you're living with pain on a day-to-day basis, your brain and your body are responding to that pain in negative ways. It's adapting to that pain in negative ways. And what happens then is that you get stuck with a nervous system that is enmeshed in a stress response. And when you're enmeshed in a stress response, it is really hard to be happy. And so Charlie was saying one of the best ways to turn on the happiness is just to get back to what's truly important to you. And how do we find that? And he says, journaling. Man, just start writing. Start imagining how you would like your life to be. What would bring you joy? That you can't hide anything when you're journaling. When you're journaling and when you're writing down the things that are important to you, the truth of your soul comes through. The truth of your story comes through. What your brain and your body wants to do comes through. It breaks through the stress. It breaks through the pain. And I can relate to this. And, after I watched the 7 hours yesterday, I actually went and drove around and did a little art tour thing. And wherever I go, I love art and I just love supporting local artists. I like meeting them and kind of learning about why they do it. And I inevitably share my story that I was caring for my parents and then I've had breast cancer. And it has been impossible to find happy in that environment. Grief is a beast. True, utter, soulful happiness. It's been missing from my life for the last couple of years. And again, that's what happens with stress. That's what happens. And so again, focusing on, we have to find those moments which bring us joy, because when we are in a joyful environment, our central nervous system behaves in a completely different way, and it calms everything down. So like this morning when I woke up, because granted I've had a long busy week and I love my job, so that was fine, but I just knew I needed to find happy today. And so I was out working in my garden for four or 5 hours this morning. That's all I wanted. I just wanted to be in my garden, and I'm happy. I'm really happy about that. So finding those things that bring us joy, I think, is really important in bringing that injured central nervous system back into normal functioning. Let me see if I have any other screenshots here. The 7 most important techniques to get your brain out of fight or flight. Number 1, intentional breathing, 4-7-8. So you breathe in for 4, you hold for 7, and you breathe out for 8. Secondly, doing mindfulness. Thirdly, soothing touch. Hello, soothing touch. This app, hugs, massages. Number 4, movement. Just getting out and moving your tush. Get out of the damn chair, get out of bed, get up and start moving, because your body is designed to move. And that is when your body's natural painkillers start to be produced, just through movement. Listening to music. Really, really good nutrition, and of course, getting good sleep. And by the way, I'm bringing in some new, you know what? In fact, I have an unboxing. I have an unboxing to do. Hold on, let me show you some of the new products that we're bringing in, a couple of which are designed to help you sleep better. Danielle says, do you know anything about vascular changes in the bladder? Yes, my bladder issues started after a surgical accident led to a laparotomy. I also was diagnosed with general anxiety disorders, have viral components, negative allergies, and autoimmune urticaria. Danielle, I would answer that in a bunch of different ways. Number 1, there is a concept of physical injury. There are many patients who have been diagnosed with IC who develop symptoms after their bladder was injured during a hysterectomy. Or for men, they suffer an injury after having a prostate procedure. That's certainly possible. The challenge is that nothing operates in isolation in the pelvis. Everything influences everything. Organs, muscles, nerves, bones. Everything influences everything. And when we see symptoms kind of explode in intensity, especially over time, we have to ask why. Is there something growing? Is there cancer? Is there a tumor? Has something else happened? But for many of us, we're cancer-free. All of us, for the most part, are cancer-free. That's when we start looking at nervous system dysfunction. Are the nerves behaving normally? Because nerves affect blood supply. And muscles affect blood supply too. You could have pelvic congestion syndrome, which completely messes up blood flow in the pelvis, which then completely messes up the bladder, which then causes IC symptoms. So your doctor and you have to be a detective. We have to look at the state of the organ. We have to look at the state of the muscles. We have to look at the state of the nerves. And we have to look at the state of the blood supply. And it's complex. It's very, very complex. But it's doable. It's a very, very doable. Now remember, we're now past the days of telling everybody you have an incurable bladder disease. The great majority of patients do not have bladder disease. So at least you're not being sent home told you'll never get better and you got to take this medication for the rest of your life. We're not doing that anymore. Marlia says, thank you also, Jill, for my supplement and for the printed info on powdered lactoferrin, which I purchased. You started pea leaf. I'm praying it will calm my very sore sensitive bladder. The literature is super helpful. You've been taking it for 2 weeks so far. You are so appreciated. I tell all my menopausal bladder compromised friends about how helpful and knowledgeable you are. Oh, Marlia, you're sweet. So how many? So we have 2 PEA products. We've got Peora and now we have Pea Leaf. So they're the same thing, palmitoyl ethanolamide. Very slight variation, but pretty much equivalent. And so back on my shelf there, you can see those blue bottles. That's Peora. Those white bottles right there are free samples of pea leaf. Look at that. I got 5 left. Does anybody want a free sample of pea leaf to help calm nerves and reduce pain? If you would like a free sample, all you need to do is email me your mailing address to icnetwork@mac.com. I am happy to send you a free sample of pea leaf. I also still have some free bottles of Uroprostis for men with prostatitis. John, did you get yours? I hope you got yours. Tiffany said, which is better to replace gabapentin? Either one. They're similar. And it's not that it replaces gabapentin. It's like a first-line option. So the way our national guidelines, and guidelines are normally set up, is we want you to do the easy stuff before you start doing things that have a lot of side effects. Gabapentin neurontin has a lot of side effects. Gabapentin acts by calming nerves. Well, palmitoyl ethanolamide, PEA, also acts to calm nerves, but it doesn't have side effects. Very, very few side effects. Extremely well tolerated. And the IC study published in 2019 showed that there was a progressive reduction in pain experienced by 87% of patients. It's what I take. So when we think about our phenotyping here, PEA is ideal for anybody with kind of nerve-driven pain as a first-line option. And then if you don't get success with it, then you can go on to the meds, which have more side effects. But that's exactly how our 2014 AUA guidelines were set up. They wanted you to do the easy stuff before you did the more dangerous stuff. Okay, let me just run out to my garage because I have unboxing. Let me go grab some things, some new things that just came in. Hold on one sec. All righty then. Okay, so I have just started working with another company called Life Seasons. Very, very highly respected. I have a couple of products that I want to make. And they're a company that I may be working with some new ideas that I have. But as I was going through what they currently sell, some things really popped out to me. So, for example, we know that, again, for the widespread pain patient, we know that being in a state of anxiety will always intensify pain because anxiety amplifies pain. So they have these anxiety gummies that the ingredients are awesome. Oh, come on. I keep knocking over this microphone sorry, YouTube. You guys keep getting sound effects from me. It's got GABA in it, L-theanine, ashwagandha, lemon balm, which is it's not citrus lemon balm helps to calm nerves down, and chamomile. You want to talk like something that we already know. Some of these ingredients can be very helpful for the bladder and very helpful for the nervous system. So I decided, anxiety gummies were interesting. They have some products that can help with sleep. How many of us have trouble sleeping? Melatonin-free sleep support. Again, with magnesium, GABA, passion flower, lemon balm. Again, it's not citrus lemon. It's not acidic. Lemon balm is calming and soothing. And chamomile. And I was thinking, for the patients who were having trouble sleeping, this might be very interesting to try. And then they have these oral strips, but these are melatonin. But this is L-theanine and melatonin that you can dissolve into your tongue while you're trying to sleep. That might be helpful, maybe. You know, we're just always looking for new things that might help. And then we are working now with the Femetry line of products. There's Femetry 1, Femetry 2, and Femetry 3. So Femetry 3 is a typical acid reducer. Femetry 2 is basically a bladder comfort supplement that's got quercetin, glucosamine, ashwagandha, aloe vera, hyaluronic acid, rutin. So it's got the bladder coating effect. It's got the soothing effect of the aloe. It's got the nerve calming effect. And, you know, kind of like I'm at the position that the more options patients have, the better. Which some would say is counterintuitive, but you know, if there's one thing we know, IC patients are stunningly unique and diverse. And what works for one might not work for the other, and vice versa. And some might have reactions to ingredients and others might not. And so to bring on another bladder comfort product that combines quercetin for the antihistaminic effect, glucosamine, ashwagandha for the calming effect, aloe vera for the soothing effect, and hyaluronic acid for the coating effect, I say it's worth a shot, especially if, you know, the major supplements like Bladder Builder and Bladder Rest aren't helpful. Why not? Let's see. And I don't have the number 1. It's deep in a box out there and I can't get it. So anyway, here's oops. Oh, I keep knocking this over. Sorry, guys. See, I'm excited. So what else did I get? Hold on. So I got the the Relieve RM, the Rest ZZ, melatonin free. Got the Femitry, the oral strips, and the anxiety gummies. I think the anxiety gummies are going to be fascinating. Absolutely fascinating. So anyway, they're not in our store yet because we just got them yesterday. And they got misdelivered to me instead of my warehouse. So they will be up and available later this week, most likely, in the IC Network shop. Tiffany said, which email address should I use? icnetwork@mac.com. icnetwork@mac.com. Gail said, hey, I just came across your live and I'm wondering if this is a channel for pudendal neuralgia. Is it more for bladder? No, girl, we talk about pudendal neuralgia all the time. And Gail, actually, we just released our flare management guide, of which we have a pudendal neuralgia flare section. See? The key thing with pudendal neuralgia, oh, come on. The key thing with pudendal neuralgia is that this is a structural nerve trauma. And we have to understand which nerve is being affected, where is it being affected in the pelvis, what is affecting it. Like I said when I started this meeting, I have a vibration in my left butt cheek if I sit for too long. That is a pudendal neuralgia of a very wispy little section of the pudendal nerve that actually curls back up into your glute area a little bit more rather than going down. This one little whisper that kind of curves around and goes back up. That's the nerve that I injured when I sat for a very long period of time. And you know, I just heard it. Thankfully, it doesn't hurt. It just vibrates. But if I stop listening to the vibration, and if I persist in sitting, especially if I'm sitting on a hard surface, I'm screwed. It's going to get worse, and it's going to take a long time to calm that nerve down. My goal is to keep that nerve as calm as I can, because sometimes it wakes me up in the middle of the night with my whole body vibrating in time with this really strong movement, which is just this nerve and muscle fluttering. We have an absolutely outstanding book called Breaking Through Chronic Pelvic Pain. Here it is right here. Yes, you get the pain in the glute. Yeah, me too, girl. This book, Breaking Through Chronic Pelvic Pain, is the PNE Bible. And the section on pudendal neuralgia in here is absolutely fantastic. There's a whole thing on the pudendal nerve. And the as he calls it, the master of the pelvic floor. It's filled with case studies, patients. So here we go. Pudendal nerve injury, defining the problem. Pudendal neuralgia is a problematic diagnosis because it does not identify the cause of the nerve sensitivity or injury that is producing the pain. Typical symptoms of pudendal neuralgia: pain with sitting, sexual symptoms, urinary symptoms, rectal symptoms. Causes: direct trauma to the nerve inside of the sit bones, which can be an effect of biking on hard, uncomfortable seats, sitting on a hard or poorly designed chairs, one or more accidents or falls, pelvic surgeries, or childbirth. And you know, when I was 13 and all of my issues started and I couldn't sit through class, I kept having to go to the bathroom. Not only did I break my tailbone that year, for sure, but I was also riding horses. You know, we had a horse. My sister was a wonderful horseback rider. I was more barn crew, but I rode horses too. And I fell off of horses too. That's some bad falls. But we now know that the saddle, whether it's from a bicycle or from a horse saddle, pushes directly into that nerve where it can cause issues. You developed it after a nerve block in the sacrum? Really? So honey, when I'm looking over here, I'm looking at what you're doing because I'm dual streaming. So I've got one computer that's going to YouTube and I've got this computer that's going to Facebook. So when I'm looking over here, I'm actually looking at what you're writing. So why did you have to have a nerve block in your sacrum? That's the important question. Um, Here we go. And then again, filled with great success stories here. As an example, he shows very specifically the nerve coming out of the sacrum, right? So here's the nerve right now there coming out of S2, S3, S4, comes out in 3 sections, merges together, goes under the Alcock's canal. When it leaves the Alcock's canal, it starts to separate again and it ends up innervating the vulva and the urethra and the clitoris and all that sort of stuff. Um, great picture of a bicycle seat pushing directly. So here we have the nerve coming off of the spinal cord, off of the sacrum. And you can see here the bicycle seat pushes directly into it, called bike rider syndrome. Very common. Also, excessive stretching of the nerve, a sagging pelvic floor. So here's a story. This is actually Jill's story. And I got to tell you, I could have seen this doctor and I didn't because I was in Kaiser Permanente. Boy, do I regret that. I could have seen the master, the best doctor ever for pudendal nerve injuries, and I didn't have the chance to. And he was only an hour away. Now he's retired. So let's read Jill's story, not my story. Jill's story serves to illustrate how excessive stretching can damage the pudendal nerve, resulting in perplexing symptoms that throw physicians completely off track. She was 32 years old, 4 months pregnant when she developed severe tailbone pain. Pain became so severe she was unable to sit, walk, or sleep on her back or side. Eventually, she began to have a horrible stabbing pain in the groin that tracked down her right leg to her calf. Any pressure around the coccyx or sacral area resulted in a painful flare. Other problems included painful sex and constipation. None of these symptoms were relieved with the use of potent narcotics or muscle relaxants. And as if all this were not enough, she was frequently experiencing total body twitches with extreme pain that required 17 hospitalizations with intravenous morphine. When Jill delivered her child, she was induced 3 weeks early and had an easy vaginal delivery. However, her symptoms continued and she still required periodic hospitalizations to control her pain. She was evaluated by many doctors, underwent a colonoscopy, upper endoscopy, abdominal ultrasound, 2 MRIs, a gallbladder study, an EEG, an electromyogram, and 2 CT scans of her abdomen. Yet, none of her 8 physicians could make a diagnosis. Therefore, she was given fentanyl. None of her symptoms were relieved with the use of these meds. When the pain continued unabated, she was offered removal of the tailbone. Concerned that the surgery might not help her either, and in a state of desperation, she made an appointment with me. And again, this is Dr. Jerome Weiss, not me personally. By the time I saw Jill, 2 years after the onset of her symptoms, she was incapacitated, unable to work, depressed, and relying on potent narcotics and periodic hospitalizations in order to survive. Upon examining her, I found an exquisitely tender left pudendal nerve, active, markedly tender trigger points, and the coccygeus muscles attached to her tailbone. Interestingly, the tailbone that was scheduled for removal was not tender, although it lacked mobility. A pudendal nerve block was done at the time of that visit for stretch-induced pudendal neuralgia from her pregnancy. She had 3 hours of pain relief following the block. On re-examination, the pudendal nerve was no longer tender, but the untreated coccygeus muscles were still extremely painful to touch. After I administered an anesthetic injection into the trigger points, I found there she had her first period of sustained relief. Continued work on these muscles with physical therapy and trigger point injections alleviated her symptoms. Jill's story is very common. It illustrates the suffering, unnecessary procedures, and expense that are the result of a physician's lack of awareness of pudendal nerve injuries. It also represents how reliance on expensive testing cannot take the place of actually examining the patient. Palpation of the pudendal nerve would have given away the diagnosis of pudendal neuralgia, and pain from the pudendal nerve can refer to the tailbone. If the coccyx had been examined, it would have been ruled out as a cause of the tailbone pain. And if the attaching muscles had been examined, they would have been tagged for treatment. The take-home lesson is that patients should not agree to any testing or invasive procedures for pelvic pain without a thorough examination by a knowledgeable physician. Okay, so Gail had her nerve block in the sacrum due to back pain, and you had pins and needles in the saddle region, but then got the nerve block and developed a whole world of painful symptoms. Girl, I'm so sorry. So, what have you done so far? How long ago was this? And what have they offered you as treatment so far? Because clearly, there was a pre-existing problem and treatment caused a new problem. And what we don't know is kind of what's driving what. Um, like, what was the original source of the back pain? Did you have a fall, an injury? Do you have scoliosis? Like, what do you think began this whole journey for you? Because if that has not been addressed, that's going to be a persistent poker at your nervous system that's going to perpetuate pelvic pain and chronic pain in the area. I would also want to know what's going on with your muscles, because when you're in pain, your muscles lock down really, really tight, and that then squeezes the nerves and makes it worse. And so we have to make sure those muscles are healthy. And then, of course, we have to, anytime you've got a pudendal neuralgia, we have to physically calm that nerve down. And the nerve block, the purpose of the nerve block was to do that. But clearly something happened during that procedure. But can we be using topicals, so a lidocaine jelly? Can we do subcutaneous lidocaine underneath the skin to try to calm that nerve? Is that nerve encased in scar tissue? Girl, this book, please get it. And I say this to everybody. You can get it in the IC Network shop. It's $6 cheaper than Amazon. If this does not help you, I will buy it back from you. I have been saying that since this book came out. Nobody has returned it. I will take a return. 6 months later, I will take a return. Because believe me, I've got other patients. If I have a used book that's returned to us, I will give it to somebody. And so it is perfectly fine to return this book if it was not helpful to you. But again, nobody's taken me up on that. That's how good this book is. Because when you read this book, you will end up knowing more than most of your providers out there. It's just an incredible resource. And there's more stories in here. I mean, it's just so good. And you have to wonder too, maybe Botox. Maybe there might be something that they can do with Botox. Maybe the pain of that nerve block puts your pelvic floor into into kind of the equivalent of proctalgia fugax, a long sustained agonizing pelvic floor contraction. And so if that's happened, then we've got to get that muscle out of contraction. And Botox might do that. Physical therapy might do that. You know, I work with patients every day, pretty much. I would love to talk to you at some point in time. It's no charge. You can call us. The 800 number is right on the top of our website. And for cases that are really complex and interesting, I will write up a case study and I will send it off to the top IC doctors for their suggestions. I've done that many, many times. And so, don't hesitate to give a phone call if you just want to brainstorm. So Gail said, 3 years, I got a nerve block. I see pain management. You get infusions of lidocaine. I've got an L5-S1 disc bulge. So do I. I've got an L5 disc bulge. I had EGM, no nerve damage in the back, but they don't do pudendal nerves or pelvic nerves. Yeah, but Gail, the question is, what's compromising the nerve? I mean, that's a real question. Again, so nerves have to be slippery. Nerves slide. They're supposed to slide back and forth very easily over tissue. If they can't slide, they get stuck. And that can be incredibly painful. So, kind of concept number one is, do we have stuck nerves? Number two, do we have scar tissue that is restricting nerves and restricting that sliding? Um, what else can we have? Could we have a tight muscle? So, for example, I've got a left side pudendal neuralgia myself. But my pelvic floor muscle, my left side, just specifically my piriformis muscle, always stays tight. No matter what I do, it's tight. And the reason why it's tight is because my SI joint's unstable. My SI joint moves too much. So my piriformis muscle locks down very, very, very tight to hold the joint in place. And so until I get my joint fixed, my muscle is always going to be tight. And I just have to work on that. And if I have a SI joint flare, which is really painful, I put on an SI belt, which stabilizes the joint and takes the pressure off the muscle. So, have you done any physical therapy at all? Has anybody checked your muscle tone down there? Yeah, definitely give me a phone call, hon. And again, for anybody who wants to try pea leaf, the the nerve calming, ideally pain reducing palmitoyl ethanolamide. I still have 5 samples. All you need to do is email me your mailing address, icnetwork@mac.com. I just need a mailing address, and I'll throw one in the mail to you, no charge. I use it. I've been using it since 2020. And I will tell you, it's been life changing for me. I no longer have the really prickly skin I used to have. My entire nervous system has calmed down, and I don't take it every day. In fact, I haven't taken it for a couple of weeks because I ran out, and I haven't. I just I'm so lazy. I haven't grabbed a bottle off the shelf and opened it. But I'm also more interested in seeing how long it lasts, and generally, it's what we call durable. The symptom reduction can last for weeks and months afterwards. So it's not something you got to take every day for some people. Well, Leah says, I just got over E. coli, cleared it up a little. UTI symptoms returned with a vengeance. Next UTI was Pseudomonas. Had to take Cipro, only cleared it slightly, but then my culture came back with no bacteria, but you're still in agony with UTI symptoms. Doctor said I could still have bacteria and wants to get a urine sample next using a catheter. Anxiety to have a catheter shoved in my bladder scares me. I've had 4 cystos in the past. The bladder wall always looks fine. Now the thought of urine sample by catheter scares me, in addition to going to have an ultrasound to check for a kidney stone due to blood and horrible flank soreness and excruciating left side tightness. I would have thought if I'd had a stone, it would have shown some bacteria. No, girl, listen, honey, if you got blood in your urine, you got to go get that checked. Come on. This is not something you wait on. Kidney stones can be really painful anyway. So it's super, super important. I mean, listen, are you going to survive having a catheter put in your urethra so they can drain a little urine out? Absolutely. What you do is you say, listen, I tend to have flares when you do cystoscope, so I really don't want a big catheter. I want you to give me the tiniest catheter you have, a pediatric catheter. Our goal here is to minimize trauma to my urethra. I don't know a doctor who would say no to that. So having a clean catch urine sample with a pediatric catheter, girl, you can do that. That is easy. You've done it before. You can easily do it again. And okay, maybe the first time you pee afterwards not going to be the funnest thing in the world, but that goes away. It always goes away. That's just the urethra saying, "Hey, man, you stretch me. I'm going to bite you back a little bit." But it always calms down. You don't have to worry about that at all. You just have to do it on your terms. And so when you go to the doctor, say, listen, this is very stressful for me. I want you to minimize trauma. Number one, I want you to use a lot of lidocaine. I want you to numb my urethra out. Number two, I want you to use the smallest catheter you have. Let's just make it as easy and gentle as possible. And you'll be done in 30 seconds. You'll be done in 30 seconds. Absolutely worth doing, given your history of complex infection. But then, Marlia, the other thing you've got to ask about is, why are you more prone to infection in the first place? If you've had 2 infections in 6 months, 3 infections in a year, you are formally in the recurring UTI group. That is considered a complex infection. That is not a simple, that is a complex infection. And that's when we have to start asking why. Generally, the first thing we look for is just estrogen atrophy. You know, your bladder and your urethra and your vulva and your vagina need estrogen to make that nice thick mucus that protects it from infection. When you don't have the estrogen anymore, it means you don't have as much mucus anymore, which means your bladder's ability to defend itself from infection is now greatly compromised. And so generally, if you're of a certain age and you're showing signs of estrogen atrophy, in addition to giving you the antibiotic, they make sure to give you a topical estrogen cream to use vaginally to improve your body's ability to defend itself against these buggers. The second thing we have to ask is there any issue with your immune system? Is there a reason why your immune system is not defending itself well against infection? And that could be maybe an immune disorder. So I have shared that I have a family member who had many bladder and sinus infections, many, over decades. And 5, 6 years ago, they finally figured out why. She has an IgG deficiency. Her body doesn't make immunoglobulins G. And so she virtually has no immune defenses against simple infections like that. So they started giving her IgG infusions. And you know what happened? Her body got better. A lot better. She still struggles. She's gotten, but it's not nearly as bad as it used to be because they have addressed the underlying problem, which was an immune disorder. Anne says, I always got catheterized as a child. Really? That's interesting. Did I always get catheterized? Maybe. Gail said, yes, she's done physical therapy. So Gail, when you went to physical therapy, what did they find? Were your muscles tight? I mean, what did the assessment find? And Gail says, pain specialist said my case is complex. You're on Lyrica and venaflexine to stop the stabbing pain while using the bathroom. I'll definitely get that book. Thank you. Pain specialist won't give you opioid painkillers or anything of the type. Worried it will trigger my migraines, even though my neurologist said I'm allowed twice a week. The problem with opioids, and I'm not against opioids. Listen, I have my little leftover prescription of Norco from my mastectomy, which, as you can see, when I just said, ow, that was my incision giving me a little dart of pain. I using an opiate every now and then for moments when pain gets out of control, I think it's reasonable. Using it every day over time, though, just what that does is that masks the underlying inflammation. And unfortunately, then you can't see if the inflammation is getting better or getting worse. They talked very specifically about that again at the International Pelvic Pain Society meeting this week. Hey, Kathleen says, Kathleen, I just want to share with the group celebrating 6 weeks without any treatments, doing fabulous. So very happy. Feel the best you've been in over a year. Prayers for all in the group. Yay, Kathleen. So Kathleen, what was it? What do you think was it that got you where you are today? What do you think worked for you? Was it physical therapy? Was it estrogen? What could it have been? Gail said, "Yeah, that's exactly what I wanted it for, only for when pain gets too much." Yeah, breakthrough pain. Unfortunately, it's just a very, very dicey topic these days. Um, it's tricky. One of the ways that you can potentially make your point is by talking about your ability to function rather than going in and saying, "Hey, I need pain care." Say, "Doc, listen, I have moments when I cannot walk to the bathroom. The pain is so severe. Or I cannot go to church and sit in the pew. Or I cannot work. Or I cannot drive. What can we do to improve my ability to function?" And when you pose it that way, the doctor goes, "Ooh, well, I know how important church is for you, so maybe we can try a little low dose opioid before you go to church, 1 day a week, little tiny bit." Kathleen said it was a combination, but definitely pelvic floor with the estrogen, and I've really been watching my diet. Kathleen, congratulations, girl. That is wonderful news. We love success stories. Love, love, love success stories. That is fantastic. But Gail, again, what did the physical therapist find when you went to physical therapy? Were your muscles tight? And specifically, was it on the left side? Was it on the right side? Was it both sides? And most importantly, did the muscles respond to therapy? Or did you always lock back down into tension? If you always lock back down into tension, that's when we have to start looking at bones. We have to start looking at bony structures that are keeping these muscles very, very tight. And of course, you've got the compressed L4S1 like I do, but um, yeah, mine presents in a really weird way. So mine happened during a fire evacuation when I had to lift a very heavy box up a flight of stairs. My dad would not leave without his gun case, and the fire was coming. And with superhuman strength, I dragged a gun case up a flight of stairs. I had no idea that I had ruptured discs, but a couple of weeks later, maybe 2 weeks later, I walked out into my garage and my right leg collapsed. It just collapsed. Wouldn't hold me up. And my knee went numb, and it felt like there was so my knee the inside of my knee went numb, and underneath my knee went numb, very numb. Um, and what did we do? So, as they said, I mean, we did the MRI, absolutely showed what I had. We know exactly what it was. I think I had a couple of steroid shots and uh, different physical therapy, but I wear a knee brace. I have to have compression above my knee. If I don't have compression above my knee, it's uncomfortable. And that's that ruptured disc. I have been wearing a knee brace ever since I did that. I'm wearing it right now. Gail said, "Yes, he knows when my mother died, I asked for a painkiller, even just one that day, so I could go to my mom's funeral. And he said no, as I can't sit. My GP gave me one. So sorry to hear all your pain." Yeah, I mean, it happens. But so, Gail, we do have a couple of chair cushions that actually might be really helpful for you. Hold on a sec. Um, So number one for me, that's the cushion that I sit on every day. And I do that for the left glute pain. It's just a left glute pain thing. To have an inch of air between my skin and the nerves and the base of it or the top of the chair cushion is really important for me. My body does not like me sitting on anything hard. I also have a different type of chair that swivels, so the seat moves back and forth like this. I don't even know if you can get this chair anymore, but I love this chair. So this is a U cushion. So you can have it this way or you can have it this way. You can even have it sideways. The point is, wherever the nerve compression is, you want to be sitting with the gap underneath where that nerve compression is. But my favorite one, and we're sold out right now, and the company's moving, so they couldn't send us any yet, is this cushion. It comes with fabric. This is a different covering for incontinence. They sent me a sample to it. But look at the design. Each butt cheek is supported, but nothing pushes up into your crotch area. And so our best-selling cushion by far for the last 30 years have been cushions with this design for anybody with pudendal neuralgia. And in fact, in this book, he talks about how you can make your own cushion. You know, the big rule with pudendal neuralgia is being extremely attentive to what you're sitting on and not letting yourself sitting on anything hard that's going to push up against that nerve and injure that nerve again. You know, I did physical therapy on my incisions on Thursday, and I cried all the way home. It's just, you just want things to get better. And it's so annoying when your treatment hurts. And it does hurt. Anne says, hold on. Marlia says, I've been living in the urologist's office giving samples for over 2 weeks. Now I'm just waiting for my appointment next week to go over the ultrasound and catheter. I'll be brave. I was just thinking that the bacteria would be present. I used compounded estriol for a month, but burns and makes my pelvis feel on fire big time. But I've toughed that out. Would estriol irritate me that much? Well, I think there might be something in the estriol that's irritating you that much, and it would be reasonable to go to a compounding pharmacy and seeing if you could try some different formulations that might not have the same base. Some creams have alcohol as a preservative. Alcohol is going to burn dry skin. So the cream that I get is preservative free. So you might do better with a preservative-free cream. Be vocal, honey. Don't take it. Be vocal. Anne says, I don't know if I have a UTI, lots of frequency. What else should I look for? I don't know if I should go to the doctor or not. Well, my rule with going to the doctor is if you're scared and if you're frightened and you don't understand what's happening, you go to the doctor. For sure. You can get a home UTI test kit. You can do that. Test your urine at home. If you have a double positive, that's another reason to go back to your doctor and get tested for infection. If your UTI test kit comes back negative, then this just might be a flare. So now we've got to think about the kind of flare you're having. So, again, you might want to get our new flare management guide, Anne. It might be helpful. Susan said, "What's happened to Dr. Evans? I'm in such a flare today." Dr. Evans, he has told me that I can tell you exactly what's going on with him. Back in January, he started getting blood clots in his extremities, in his legs, and in his arms. And these are blood clots that move. And blood clots are very dangerous because if they go up to your brain, that's a stroke. If they end up in your heart, that could cause a heart attack. And or in the veins supporting your heart, that could cause a heart attack. So he's in the last time we talked, which was about a month ago, he couldn't stand without very, very severe pain. He can't perform surgery. He can't run clinic, anything like that. The scary thing about this diagnosis is this finding of blood clots is often a precursor for very aggressive cancer, like pancreatic cancer. And so he has had all of the cancer tests. All the cancer tests came back negative, but believe me, I'm sure it scared the hell out of him. So now they're thinking that there might be a rheumatologic origin to the blood clot. So he's been working with the rheumatologist this month. If they can stop the blood clots, then he will go back to work. He wants to be back at work. He wants you to know that he's working really hard so that he can come back in clinic. Um, but he said he gave himself till July 1st. And if he doesn't have success in the last 2 weeks of this month, then July 1st will be his retirement day. And we have to find a way to say thank you to Dr. Evans because he has been the best IC doctor in the country for the last 25 years. Every single time we have had a vote for top doctor, he won. Massively won. Nobody ever came close. And so, yeah, definitely we need lots of prayers for Dr. Evans because he's a gentle giant. He's a big guy. He's like a big old teddy bear. He's a big guy with a soft voice, and the great majority of patients who see him love him. Retha says they're out there making grocery money. Who's out there making grocery money? I don't know what you mean. Okay, Gail said, "Oh, the cushions are great. I currently have to sleep or rest on my stomach or on my right side. Yes, the couch looks like it might the cushion looks like it might help as I can sit on a toilet seat." Yeah, I mean, he talks really specifically about this, hun, in the book. Let me see if I can find this section real quick. I mean, if you don't have pain when you sit on a toilet, that's like a slam dunk. Slam dunk pelvic neuralgia, pudendal neuralgia. You've got to get this book. Let me see if I can find that section about the toilet seat. Talks about avoiding any exercise that stretches the pudendal nerve, therefore, no bike riding anymore. Working with weights or on exercise machines. Swimming is good, but you got to be careful with how you move your legs, etc. You got to no squatting exercises at all. Anything that flexes the hip over 90 degrees, can't do it. Anyway, so I have so for me, my pudendal neuralgia is about 2 inches to the left of my rectum. And so the travel cushion with a groove down the middle doesn't really work for me because it's like right on the edge of the groove. Um, And for my glute pain, the waffle cushion has kept me working for a decade now because I did this like how long ago? Like 15 years ago, 18 years, 20 years ago, somewhere in there. If I'm having rectal pain or vulvar pain, I will switch over to the travel cushion until that calms down. But my day-to-day cushion that I've got a cushion here, I got a cushion at my kitchen table, I got a cushion on my chair when I paint. This is the cushion I sit on. Um, and the cushion usually lasts about 6 months. Um, but if you have a cat and they jump on it, their nails are gonna perforate it and then you're done. You just have to get another one. So you got to really protect it if you got pets in the house. Marlia says, sorry about Dr. Evans. Did you ever watch the YouTube interview called COVID Plots with Cheryl Atkinson? Due to the vaccine, this interview will scare the hell out of you. It's not, that's not the situation that he's dealing with that we're aware of. And by the way, this new COVID variant is, I have a friend, who a family member died of the new COVID variant like 2 weeks ago. Peggy said, is he teaching someone to take his place in case he has to retire? I hope he gets better soon. We need all the help we can get because there are doctors out there who still don't believe that IC doesn't exist, which is really sad. Yeah, he's taught a lot of people. I don't know who is covering his cases right now. I think, if I remember correctly, there might be a nurse practitioner who might be seeing more patients, but I'm not sure. And we just have to wait and see what happens July 1st, and I will reach out to him again, and I will ask him very specifically what he wants me to tell you. So, have you guys been hanging out with your dad? Have you called your dads? Because it is Father's Day. And for those of us whose dads are up in heaven, think. Let me see if I can come up with a funny. So my dad was my doctor. My dad was great for taking me to the emergency room and taking me to the doctor. So one night at 2 a.m, I was bit by a black widow spider. I had seen it in my bathroom. Literally, if you sit on the toilet, you can look at the mirror and look at the sink. And over in the corner underneath the cupboard, I saw a little black widow spider for weeks. It would come out at night and then would crawl back in. I couldn't kill it. And I won't spray that stuff in the house, right? And so, it's kind of like this where I live. There are black widow spiders everywhere. It's just like, it's not doing any harm. And then at 2 a.m, I am brushing my teeth and I felt it bite me on the top of my foot. And I could look down, got down on my hands and knees. It saw me, I saw him, and he crawled back up in his hole. And I was like, God bless America. I just got bit by a black widow spider. Well, what it does is your muscles go into immediate spasm. So in the first 15 minutes, my foot went numb. And then the numbness spread up my legs slowly. And my dad, everybody was asleep. I was just here. Didn't want to wake everybody up. And it kept getting higher and higher and higher. And then I hit my knee. And I thought, okay, if it gets into my thigh, I'm going to have to go to the ER. And it was my right leg, so I couldn't drive because I couldn't press the accelerator because I had no control over this leg. And so literally at 3 a.m, I woke my dad up. And I said, Dad, you got to take me to the hospital. He's like, why? He goes, I got bit by the black widow spider in the big bathroom. It's like, really? It's like, yeah, look at my leg. It was as hard. It was like concrete. And so at 3 in the morning, he drove me to the ER and they got me right in and they gave me massive, massive muscle relaxants. So I think I slept for 3 days. I just massive muscle relaxants and it finally went away. So, you know, and a lot of you saw him because he would come into these meetings and he would say hi and then he'd get grumpy if I hadn't made him food. He lived till he was 100. I cared for him the last 20 years of his life, So, anyway, the stories I could tell about my dad are great. I haven't felt him. I feel my mother a lot more than I feel my dad. I think he's hanging out with his bros in heaven. Laura says, I have a torn hamstring at the insertion point, ischial tuberosity. Waffle cushion just allowed me to fly to Europe and participate in a choir tour and use it at home. And now I carry it when I go out. Dark gray, 17-inch variety at a medical supply. Yeah. Yeah, they're great. We get ours from the company that invented them. And they're pretty affordable. I mean, I think they're in the 30s. Peggy said, "Oh my God, only you. I am so scared of spiders." No, I'm not scared of spiders. Although I've never seen a brown recluse spider. I'm probably more scared of snakes. But I mean, I pick up snakes. Jill Osborne, I just want to say you're a breath of fresh air and your knowledge and positive enthusiasm is all that keeps me going. Thank you. You're very welcome, girl. My job, IC Network, it's where where the patients come to find hope. That's why my magazine's called the IC Optimist. A lot of people say, why do you do this? And my answer is because I want to say to somebody what nobody said to me when this happened to me. And that is, it's not your fault. You've done nothing wrong. There's no shame. There's no blame in having bladder or pelvic pain. You're hurt. And I just remember how isolated I was and how lonely I was and how frustrated I was to watch my friends getting married and having babies while I was basically laying in the fetal position in my bathroom for years. And as I've shared, I had a doctor say to me, "You will forever be a burden on your family. This is your life. Get used to it. You will always live with severe pain." And that's what woke me up. And I went, "Now, wait a second, you son of a bitch. How dare you say that to me? I'm going to prove you wrong." And I went home and I started studying. Now, granted, listen, it helps that I have a pre-med degree. Okay, that helps. I have a bunch of college degrees and I love college and I love studying. But I was not going to be a burden on anyone. And this is, knowledge is power, my friends. Man, the more you learn, the more skills you have that can get you to a better place. So it's really, really, really important that you take the time to read. And we were, again, at this conference, we were all so incredibly frustrated to find out that the great majority of young women now get their health information from TikTok. And so they were analyzing the information provided on TikTok, and it was terrible. Just like the old days of Facebook, terrible. So how do we get patients to read and learn, this is a life-changing book. It changed my life. It is fantastic for anybody with a muscle injury. But people don't want to read right now. All I can say is, man, if not you, who? You got to invest in your future. And you deserve more than a guess. You need facts. And you get these facts when you read and you learn and you understand and you study. Gail said, what test would I need to get to see if my muscles were a problem? You would need a pelvic floor assessment. A pelvic floor assessment. And these are done by certified physical therapists. We have about 10,000 physical therapists now in the last 10 years who have had the proper training, because this is not Kegels. We don't do Kegels. Basically, when you go for that pelvic floor assessment, and I can help you find a physical therapist, we have a really good database for that. This is a new set of eyes looking and studying your body and studying your pelvis. And so your ability to describe your symptoms gives them a roadmap on where to look. So you don't walk in and say, hey, man, I've got interstitial cystitis. That's pointless. You have to go in and describe your symptoms. You have pain when you sit down. You cannot lay on your back. I couldn't lay on my back either, and I couldn't lay on one side either. We're very similar that way. I slept on my stomach for years. Now I can lay on my back. But to be quite honest, I sleep in a recliner. That's a whole nother story. That's my jaw. If I lay flat, my jaw starts to dislocate. So I always have to lay it with a little bit of an angle. So anyway, when you go, you need to be able to describe your symptoms pretty much in depth to give them that roadmap. Normally, they're going to have you walk up and down a hallway. We want to see how you walk. They're going to measure your legs. You have one leg longer than the other. We want to see how your hips are functioning, your knees are functioning, your feet. If you have an ankle that rolls in, ankle that rolls out, that does put a lot of pressure on your pelvic floor muscles. So there can be wear and tear injuries over time. And then they will ask if they can do an internal exam. That is the single most important part of the exam. You're not in stirrups. It's nothing like that. You're basically laying on a PT table. You've got a sheet over you. Your knees are up slightly. They've got a glove. They have KY. They stick their finger in your vagina. All they're going to do is touch muscle groups. A healthy muscle feels like a raw chicken breast. It's soft, but it has substance. A tight muscle feels like a cooked chicken breast. It's stiff and rubbery. A badly damaged muscle feels like beef jerky. It doesn't give it all. And so all they're going to do is touch muscles on the left side and muscles on the right side. Take a minute or two. And if they can touch a muscle and trigger pain, that is what I call your hallelujah moment. That is like, oh my God, that's it. What are you touching? What are you touching? That's it. And hopefully you will walk out of that appointment knowing the name of the muscle. Odds are it's going to be your piriformis muscle, given the piriformis, the pudendal nerve transfers through the piriformis, but there can be others. And now it's about working with that muscle directly with a very specific set of exercises for that unique muscle. Sometimes it's on your left side. Sometimes it's on your right side. Sometimes it's on both sides. Gail says, wow, that doctor never should have spoken to you like that. Knowledge is power. I got an internal assessment. She just found muscles were slightly tighter on the left side than the right side. Okay, but that's important data. That's very, very important data. Now we have to understand that, because what that says is that we have a dysfunction on the left side. And we have to understand the biomechanics of that a little bit more. Bonnie, did you lose your dad in 2022? I lost mine on May 12th of 2023. A day that will live in infamy. Listen, he made it to 100. He was a jolly old soul, and he took it so well. I mean, I thought we'd have him for another 5 years, to be quite honest. He was strong, going up and down stairs, but he had a lot of stomach pain. It turned out he had a hiatal hernia. For years, we thought he had GERD. He never had GERD. It was a hiatal hernia the whole time. We only learned that 2 weeks before he died. And, yeah, he finally had a heart attack, and it was just exactly the way you would want somebody you love to go. It was sweet, and it was just perfect. There was just no suffering. The last thing he said to me was a quote about death, and I have forgotten what that was. I'm gonna find it, but it was really good. He's a smart guy. Had a giant brain. Normally when you get older, your brain shrinks, and they thought he'd had a stroke a couple of years ago. It turned out he had an ear infection, but he was in the hospital for a couple of days as they were trying to figure out this weird head pain he was having, and they did a CAT scan of his brain, and it was enormous, and the doctors came out afterwards and said, "Jack, we've never seen this before. Your brain is not normal." Yeah, normally it shrinks. It should have shrunk 20% at the age of 100, and his was huge. And I think the only thing I can attribute that to is that he read voraciously, and he watched everything. He was just very engaged in life. Aaliyah said, "I'm definitely going to get Rest Easy supplements, average 2 to 3 hours a night. Ashwagandha, I thought I read something on it about liver problems, but not sure. That supplement sounds like it will help too. My grandson takes it. It helps with anxiety. It's worth a shot, honey." Laura said, "You lost yours on November 29, 2021 at 91 to cancer." Oh, 91 years. What do they say? They say in grief that, and if you ever watch mediums like Tyler Henry, which I do, or I'm fascinated by those also. Um, Inevitably, souls say, please don't keep thinking about how I died. I want you to remember how I lived. Don't worry about the last couple of days. That's not my life. It's about family road trips to the beach. It's about I remember my dad made taffy, and we were all pulling taffy in the kitchen. Or he would make icy lemonade with a fresh lemon and ice and sugar in the blender on a hot Saturday. He had his bad days too. He could be cranky, but hold on a sec. Katie said, "My spider bite blister did not worry. Arm swelled a lot. I pressed the blister a little. A tiny piece of spider was stuck like a stinger. My advice, go to a hospital. Don't try to fix it at home." Kate, excellent advice, my friend. Excellent advice. And I did go to the hospital. Gail said, "Sorry for your loss. Wow, 100 years old. My mom died on the 24th of December last year, but suffered a lot. And she also had dementia." I was talking to somebody, oh, last week, actually. I think it was on Friday. And I was saying that, you know, when you lose your parents, you're not you're not the person you were before. You're just not. You're different after that. And it's not a bad thing, but it's a level of maturity, it's a level of grief, it's a reckoning about our own lives. And I find for me, I just what I just want him to be remembered. And that's probably what I struggle with the most, even me personally, is that, come on, a couple generations out, we're really not going to be remembered. Um, it'll be, oh, that great Aunt Jill. I am my generation's Auntie Musher. My grandmother had an aunt like me, who fell in love with a man, but there was a religious issue and they did not get married. And she loved that man for the rest of her life. And in fact, this is the ring that he gave her, and I inherited this ring. So this is Auntie Muster's diamond ring. And I I she met me. I don't remember her because I think she died, like 5 or 6 years after I was born. But I've always felt very strongly connected to Auntie Muster, and she is a strength for me. In fact, I even have an award she got in my hallway because I don't want people to forget her just because she was the single aunt, like I'm the single aunt. And that's really hard, being the single aunt. Believe me, I don't want to be single. I would much rather be in a relationship. But you're kind of left to the side of family activities, and that's painful. So anyway, Auntie Muster. So whenever you see me wearing this ring, it's all about welcoming the strength of Auntie Muster, because I think she was a very, very strong woman. This is the only piece of jewelry I have that's worth anything. Not that it's worth a lot. It's not. But I think she's smiling. I think my mom's smiling, that because my mom had it. My mom inherited it. She wore it every now and then, but I always wear it when I do these meetings. Gail said, a part of me died with her. I have on my Twitter page, I was listening to a fantastic podcast on grief about a week ago. And on my Twitter feed, I forwarded it, and it was with this woman who's I forget what her credentials are, but she's very, very highly respected. And she was talking very specifically about the connection, the loss of connection. I mean, like let's see. I feel like we have a light between our soul and the souls of those we love. I do. There is, and that's people, and that's pet, that there is a direct implicit connection that becomes a part of how we function. And she was talking about that the hardest part of grief is that connection gets broken. That immediate, sustaining life force connection is severed. And so one moment you have the strength, and the next moment, and it's palpably gone. I mean, you feel it's gone. And it leaves you kind of floating like a balloon in a way, without any anchors, because the connection is gone. But she is also talking about how you rebuild that connection. And so the light, so imagine, for the way I visualize it is that it's a golden light that spreads to everybody that I care about. And when one gets cut, that energy gets passed on to the other connections, and it gets brighter and it gets stronger. And it was an absolutely fabulous podcast. If you go to twitter.com, IC and Jill, and look at my tweets, it was like a week or 10 days ago. It was a phenomenal podcast, and it gave me a lot of comfort because, I'm gonna cry, and I don't wanna cry, but, you feel so empty, you know? You just feel but it's not emptiness, it's lost. It's this empty space that should be full. Ugh, and so she talked about that, and she talked about how do we fill that up again, and how do we make those new connections. So, like, I have a really strong connection to my sister, and I have a really strong connection to my brother-in-law and to my nephews and to my friends. I feel like my soul wants more. Okay. Okay, no more. Because I can go down that pathway too. Yusuf from Saudi Arabia. Thank you. Thank you, Yusuf. I want to ask if stem cells help in treating interstitial cystitis because I heard that they can be treated, especially from those made from the placenta. No, that's actually not true. Number one, we have a lot of stem cell research with IC in the bladder, mostly from Asia. And it's not the placenta stem cells that have gotten the best effectiveness at all. Actually, it's adipose derived stem cells from fat that literally they do liposuction. They take your own fat and then they process it to select out what they stem cells and what they call growth factors. And then that's what they use so that you end up with a medicine of your own stem cells and your own growth factors, and then they inject that back in. So I read all of those studies, and I think I've only seen in the last couple of years one study that talked about placenta derived stem cells, and I don't remember what the results were at all, to be quite honest. But what I can tell you is that it's the adipose derived stem cells and growth factors that have found the most success. We have the California Stem Cell Treatment Center here in California. Remember, we phenotype now. So we always have to ask, what are we trying to accomplish? We have to first understand what's driving your pain. Is it the bladder wall? Is it the pelvic floor? Is it the nerves? Or is it something else? And then, so once you've been properly phenotyped, then that's when we start matching treatments to your unique case. So the vast majority of men have muscle problems. Like 90 to 95% of men, at least the men that I work with, show very clear signs of pelvic injury, pelvic trauma. And so the proper treatment for these men is actually physical therapy. We've got to get these muscles healthy again. So Gail said, yes, it's the loneliness. Even though you're around family, emptiness. My soul wants more. It wants my mom. You're an amazing human. So kind. No, you're not me, girl. Hey, listen, that's the other thing. You got to understand that tears are fine. I don't regret crying at all. I have cried more in the last 2 years than I have cried in the rest of my life combined. And it's okay. It's okay. It's a proper and appropriate expression. Like I said, I cried on the way home from physical therapy on Thursday. Or what didn't? No, it was Wednesday. And it was that we were manipulating my because I had breast cancer last year, so we were working on my incisions. You can just see my incision right there. These suckers hurt. They hurt like a bitch sometimes. And so we've just been trying to get them to relax and release. And but it's just a lot. So I'm glad I cried all the way home. I'd rather cry and get my stress and frustration out than keep it all inside. Cherry says, are there any electrolyte safe drink powders? No, there are not, my friend. There are no safe electrolyte drink powders. No. And, because most of them use citric acid. I mean, I put on our website like 2 years ago how to make your own electrolyte drink that's bladder friendly. You could go over to the IC network and see if you can find that. But Cherry, let me ask you this. Are you doing it because you're dehydrated? Or are you doing it because you're working out a lot? Gail said, yeah, it's a normal thing to cry. Sorry to hear you had breast cancer. You're my prayer. Yeah, lost my parents. 9 months later, got breast cancer. You look at the stress scale, and I hit the top worst. And almost all my doctors and everybody are like, how are you standing? How are you not massively depressed? How are you functioning? And the answer is, I love my job. And I have little connections to all of you. I really feel that. I really feel like I've got this soul connection with everybody that I work with. Jerry said, I have muscle cramps and radiating pain to my quad. So, I had terrible muscle cramps when I went through menopause. Terrible. Like between the ages of 48 and 52. And that's actually they were rough. Muscle cramps are actually pretty common as you're going through aging. Um, what my doctors all had me do was to go on magnesium, and I will say I do magnesium glycinate. If I don't do it for about a week, the cramps start to come back. But I can't do a lot of magnesium. I can't even take a whole one because it'll give me the runs. So I take, like a quarter of a magnesium just to try to keep them at bay. All starting from the pelvis. I'm 300 times 3 in Tylenol 3 times, stopped working. Menopause was 5 years ago. So where specifically are the cramps? Are they in the left side? Are they inside your pelvis, or are they in your legs or your back? Where are they? Yusuf says, does IC require pain in the bladder? Meaning if there's only a burning sensation when urinating without pain, does he have the disease? Well, interstitial cystitis is not a disease. Interstitial cystitis is a pelvic pain syndrome for which there are many potential causes. So we have massively stepped back from the perception that IC is a disease. Our latest guidelines here in the United States actually say we just don't find bladder disease in the great majority of patients. The only disease that we're finding actually is if he has Hunner's lesions in his bladder, big bloody wounds in his bladder, we're finding viral infection, specifically the Epstein-Barr virus or the polyoma virus, are known for infecting the bladder wall. But if he doesn't have lesions, then what he has is a pelvic pain syndrome. And now he's got to be phenotyped to try to figure out what's driving those symptoms. The hard part here is that these are bladder symptoms. You're like going, it's got to be my bladder. And most people are going, it's got to be an infection. I'm peeing all the time and it hurts. But the urine cultures come back negative, and typically the bladder looks normal for patients who have this. There might be a little redness, inflammation, but for most of us, myself included, perfectly normal bladder. So, what a lot of people don't know is that muscles, dysfunctional muscles, can cause all of these symptoms. We call it myofascial frequency urgency syndrome. This is where muscles end up restricting blood supply to the bladder or compromising nerves that support the bladder, causing these symptoms. But bladder treatments don't work. What works is getting the muscles healthy again. And again, for the vast majority of men, straight on, it is a muscle injury. So I would ask, did they fall? They fall on their tailbone. Is there any history of pelvic trauma? Were they an athlete? Were they riding a bike? Were they riding a motorcycle? Did they play soccer or football? Kate says, great session. Thank you. Feeling orphaned as adults by parental loss is something rarely discussed. Yeah. And see, the thing, Kate, is you think you're ready. I mean, I specifically, a very good friend of mine, like 2 weeks before, said, Jill, it's getting close. Are you ready? And I was like, yeah, I'm ready. I know it's getting close. I'm fine. But number one, truly, you are never ready to see a parent take their last breath, or you are never ready to hold a cold hand. You cannot prepare for that. It is a shock of shocks of shocks. And so we just have to be so gentle with ourselves when you go through something like that. It is a deep, profound life experience that will change you. And I hope what it does is that, like for me, I lost them both within 3 days or 4 days. As I've said, is listen, I always thought, okay, if I lost dad, would mom and I be okay? Yeah. If we lost mom, would dad and I be okay? Yeah. Never dawned on me I could lose both of them at the exact same time, which I did. And yet, so that was horrific to go through. I was inconsolable. The first couple of days. But now, see, here's the thing. It was a 75-year love story. They were together for 75 years. And if you had given either one of them the choice, do you want to go with your partner, or do you want to stay? They both would have said, I'm going with the person I love. And I think for me, knowing how hard it was for me to expect my 94-year-old mother to have gotten through the grief of losing her husband of 75 years, no way. It would have been cruel. I can understand why she went. They called it broken heart syndrome. She basically had a couple of strokes. And so there is peace in knowing that. There is peace in knowing, and comfort in knowing that she got comfort when she needed it the most. They both did. And so let's celebrate this wonderful 75-year relationship and let them fly. And just let them fly. And they're around. I feel my mom, but I will tell you, my dad wakes me up in the morning sometime. He used to come into my room and he would go, you got to get up. You got to get up. You got to get up in the morning. And as a child, with my sister and my brother, that's how he woke us up. You got to get up. You got to get up. You got to get up in the morning. World War II vet, right? And he did that all the way to the end. He would sing my mother awake. He would sing me awake. But if I ever pissed him off, he had a way of saying my name that got my attention. And I once, that last week, he had a walker for the first time, and my mom had a walker, and I had to take her to the bathroom, and I moved his walker out of position, and he couldn't get to it, and he had to go to the bathroom, and he let out a blistering, "Jill!" And I heard him I was in the bathroom with my mom, and it was like, "Oh, I know what that is." I go running back, give him his walker. And he twice now I've woken up to him yelling Jill, and that he woke me up last week yelling Jill. And so I always tend to think that when something like that happens, that there's something that I'm supposed to be doing. Hold on. Gail says I'll be in contact. Yeah, thank you. You're very, very welcome. Please give me a phone call. And we love Ireland. So sleep well, hun. Yusuf says, is there a similarity between chronic prostatitis and interstitial cystitis? Yes, they're virtually identical. They're both pelvic pain syndromes for which we have to figure out the underlying cause. I actually sat on the guidelines committee for male pelvic pain. We just released new guidelines a couple months ago. So, they're neither one of them is a disease process. They are a syndrome. These symptoms can be caused by many different things. So now we have to figure that out. But again, I'm just going to say the great majority of men diagnosed with chronic prostatitis and the great majority of men diagnosed with interstitial cystitis actually have an underlying muscle problem as that's driving all of their symptoms. Marshila says, I had 3 fulgurations and concerned about another one because of scarring. I'm taking lactoferrin and it helps a bit. Could you suggest any other supplement to help with the Hunners? Not really, hun. The only supplement where we see really good success with Hunners is the lactoferrin. I mean, so we have to think about what causes a lesion. So what causes a lesion is either a viral infection or neuroinflammation, a nerve that is very, very inflamed. And so we've also linked lesions actually to a damaged ligament in the pelvis. It's called the uterosacral ligament. And that ligament happens to hold the nerves from the bladder in place as they're coming out of the bladder to go to the spinal cord. This ligament is a placeholder. It's a vital structure for nerve position. So if that ligament gets stretched out, the nerve gets stretched out. And we have directly linked this to the formation of lesions because that nerve becomes super, super inflamed. When the ligament is repaired, the lesions have gone away. This is called posterior fornix syndrome. I have an article on our website with a published case study. And if you go back and you look at the researchers who have worked with this ligament for the last 30 years, they have talked very clearly and specifically about how damage to this ligament can lead to bladder symptoms. So I would be more inclined to try to focus on identifying other underlying causes. I mean, I think having a viral test, just if you have any active Epstein-Barr viral infection would be good because if you do, they can give you an antiviral. That would help a lesion. If that comes back negative, then I would say it would be very interesting to explore the whole ligament issue. And that's a very easy way to do it. Gynecologists can very easily see if you've got damage to that ligament by putting a speculum up and lifting part of your cervix. And if you lift your cervix and your symptom goes away, that's a damaged ligament. So I have an article on our website, posterior fornix syndrome. and the case study that was published with that. Hello, David. Long time no see. Okay, so hold on a sec. Chariot, pain in the ovaries, they radiate to the thought. Okay, we already did that one. Okay, Peggy says, has a peaceful night. Okay, Sherry says, you're on bladder builder and lactoferrin. Okay, good choices. David said, if Hunner's lesions are from a virus, can we take an antiviral? Yes, and they have been studying that. The same virus, the antiviral that they give for herpes, what's it called? Oh, the name is on the tip of my tongue. Oh, come on. It's just like right there. It'll come to me. I want to say Valtrex, but I don't think that's right. No, I know that's not right. And is it a cyclovir? Here, hold on. Yeah, it is. Acyclovir or valacyclovir or famciclovir. Hopefully, I will inherit my dad's bigger brain as I get older. Hopefully. Marshila, if you haven't done, I mean, the PEA to calm nerves down and to reduce pain, I think the Peora or the Pea Leaf would be certainly something worth adding just to reduce pain and discomfort. And the research behind that's really, really solid. Yusuf says, does food sensitivity differ among patients with interstitial cystitis, meaning some of them drink wine, coffee, and are not affected while others are? What is the secret behind this? It's their phenotype, hun. There are 5 fundamental phenotypes for IC. Hunner's lesions, which are wounds in the bladder wall driven, which is often driven by chemical injury, or for women, estrogen atrophy. Pelvic floor driven, that's driven by muscles. Pudendal neuralgia, these are nerves that are compromised by tight muscles. And our final phenotype is what we call widespread pain. These are patients who have an injury to their central nervous system that is manifesting with bladder sensitivity, bowel sensitivity, skin sensitivity, you name it, that's that. And so the food sensitivity really depends upon phenotype. The patients who are going to be the most food sensitive are going to be the patients who have Hunner's lesions, or for women, estrogen atrophy, or patients whose bladders have been injured through using ketamine. The patients with the least food sensitivity are the patients who have pelvic floor driven symptoms, or pudendal neuralgia, although they're going to be sensitive to caffeine because caffeine amps nerves up. We have a really good section on food over on the IC Network website. And I just updated our diet, our 2025 diet, talking specifically about phenotypes and how that predicts your food sensitivity. And we will be doing this summer an IC 101 guide to the IC diet. That's also in the works. Yusuf said there are those who drink coffee and tea and are not affected, but are affected, for example, by eating tomatoes. Well, that's a little unusual. Hi, Boria. If you have a wound in your bladder, acid on the wound hurts. So tomato, it's going to hurt. Lemon, it's going to hurt. If you put alcohol on a wound on your hand, it stings. It would hurt. But if, for example, somebody like me, I have a healthy bladder, but what I do have is a very, very sensitive nervous system. And if I drink anything with caffeine, my heart goes nuts. Like, I'm on heart medicine for this. I get severe arrhythmias with caffeine. And the last time it happened was probably 4 years ago. It was right before COVID. And I ended up in the ER with this crazy arrhythmia, tachycardia. And, the ER doc was like, you may never, ever have caffeine again. You are too sensitive. And I don't, I don't know why. My dad could drink coffee. My mom could drink coffee. I just have the weird redhead gene that says I can't do caffeine. So, and I miss it. I love coffee. Yusuf said, what should I do if I feel burning sensation after urinating? What should I do to stop this burning after urinating? Okay, so where specifically is it burning? Is it burning like at the tip of your penis? Is it, because you're a guy, right? Or is it burning up inside your pelvis or in your bladder? Where is it burning? That's a vital question here. Boria, how are you today, hon? Nice to see you. So what's on tap? So Marty, so we released the spring magazine a little late because that is our new flare guide, our new updated guide to managing IC flares. Really happy with it. Our summer magazine is all science, my friends. It's the latest news from the American Urology Association, the new research on IC. It's going to be the latest news from the International Pelvic Pain Conference. It's going to be the latest news from a European conference I did a couple weeks ago. So our summer issue is going to be a bunch of new research. I just have to have the time to rewatch those sessions. My goal is to have it out in August. John says, I think the prostate supplement is helping. John, okay, dude, they expire in November. I've got like 7 bottles left. You can have them. If you want them, I will send them to you, no charge. Because I have known you for a long time and I have known your challenges and I am just more than happy to give them to you. So you let me know. They expire in November, but I say power to you because it has been discontinued in our store. And so I have these bottles and I don't want to throw them away. I'd rather them go to somebody that they're helping. If anybody else out there has a husband with a prostate issue, pop me an email, icnetwork@mac.com. This is a supplement, Uroprostus, made by the same company that makes Natural Approach Nutrition. That makes Bladder Builder, Natural Approach Nutrition. I'm happy to give these away. I'm more than happy to give these away. Yusuf said, please mention all the nutritional supplements that would help me overcome bladder sensitivity and burning after urination. So burning after urination is usually muscle, son. So the question that we ask is, when is your pain the worst? Before you pee or after you're done peeing? If your pain is worse before you pee, like when your bladder's really full, that's from the bladder wall. But if your pain is worse after you're done peeing, that's usually from your pelvic floor. Because muscles that are working hard produce lactic acid, and that causes a burning sensation. So, I hate guessing. I think it's important to have facts here, and I don't want you to waste your money on something that doesn't have a chance in hell of helping. So oh, I'm glad, Kate. Kate says, you gave great advice on acidity, which I follow strictly. More water really helps. It does, girl. It does. So, Yusuf, if we're trying to reduce pain, it would be Peora or pea leaf, because that calms nerves down, and there's a ton of research behind it with it. Acute pain, chronic pain, surgical pain, chronic prostatitis, chronic pelvic pain. So Peora in the IC Network shop, or pea leaf, Pealief. I think we can ship to Saudi. We might be able to ship to Saudi Arabia if we might. I'm not sure. You would have to pop me an email and I can ask. If food is triggering you, then I would be doing pre-leaf, because that's a calcium supplement that will reduce the acid in the food and make the food less irritating. So pre-leaf makes sense. If you're having a bladder wall flare from eating something you shouldn't have eaten, like tomatoes, you could do something that would soothe your bladder. You really need to get our flare management guide, because it lists everything for each type of flare. So for a bladder wall flare versus a pelvic floor flare versus a pudendal neuralgia flare, we talk specifically about the supplements that you could do before resorting to a traditional med. Are the symptoms of bladder neck elevation or chronic prostatitis the same as the symptoms of interstitial cystitis? Well, let me refresh my memory on bladder neck symptoms. Hold on. The challenge that men have that women don't have is the prostate and the complications with the prostate, and the fact that as men age, the prostate tends to get bigger and bigger. We call it benign prostate hyperplasia. And so that prostate tissue begins to interfere with the urethra, and it interferes with the bladder neck. And so what happens is it compresses it. And what that means then is it's hard to pee. You get urinary retention. It might be hard to start urination. You might not have easy flow, poor flow. Those are not symptoms of IC at all. Classic symptom of IC is pain as your bladder fills with urine that is relieved by urination. Anytime we're looking at urine flow stopping and starting and stopping and starting, we always instead have to look at what can interfere with urine flow. And that's either going to be tight muscles squeezing the urethra, or for a man, something to do with some hyperplasia in the prostate. Good question. How is care in Saudi Arabia? I know that there was a I think the International Pelvic Pain Society had a conference there last year. Maybe 2 or 3 times a year, I have a patient call me from Saudi Arabia or reach out to me from Saudi Arabia. So, my sense is that there's not a lot of care providers that are kind of specializing in pelvic pain. Although, again, there was a training conference there recently. So maybe it's getting a little bit better. You know what? Actually, hold on a second. Let me look at something here real quick. Let's see if there are any certified physical therapists in Saudi Arabia. Okay, Saudi Arabia. Look at that. It came right up. No. The nearest physical therapist who's got training is actually in Cyprus, in Greece. And that actually is a gentleman. Yeah, it's a male physical therapist who has his doctorate, and he is at the Eastern Mediterranean University Physiotherapy Department. How cool is that? So he might be able to help, although he might. It's always worth a phone call. All right, guys. Well, listen, let's do, I think we've come to the natural end. Well, hold on. Here's Marlia. I am a hypersensitive fight or flight reactor type personality, so I have bad burning all the way up into my belly just before I have to pee. I really believe I have autoimmune issues. So what is the best supplement? Well, yeah, but girl, the fact that you're a fight or flight personality tells me it's your central nervous system, not your autoimmune system. It's that your central nervous system is messed up. And that actually was the theme of the International Pelvic Pain Society conference this weekend, is how this jacked up central nervous system can drive all of these symptoms, and how it leads to pain being uh, amplified throughout the body when we have a central nervous system that is stuck in fight or flight. That's how I started this meeting out. We were kind of talking about that to a certain degree. So, what's weird and unusual is, okay, so we already know that for 80% of the children who grow up to develop widespread pain, there is a major physical injury. And for the other 20%, it's a history of bullying or abuse. And it's a bullying or abuse that's really consistent in the patients that I work with. And so, as I said on Friday, I swear I was talking to my twin. We were just like virtually identical in age and in how all of our symptoms presented, as well as that childhood trauma. Both had suffered from severe anxiety disorder. Me, not anymore, but she's still stuck in anxiety disorder. And so we have to get that brain out of fight or flight for everything to calm down. Janelle says, does somatic training help with calming the nervous system? Absolutely. There are very clear ways to calm the central nervous system down. And hold on. I had a screenshot from the conference. Let me see if I can find it. Okay. The 7 most important nerve calming techniques. Number 1, breathing. So 4-7-8 breathing turns off the vagal nerve, or the vagal nerve has one section above and one section below. Okay. And it's the section below we're trying to deal with. And again, I have to rewatch everything to say it exactly the correct way. I'm not saying it exactly the same way, but there is a breathing technique which calms the vagal nerve down, and it's a 4-7-8. So you breathe in for 4, hold for 7, breathe out for 8. And understand, these are the top pelvic pain doctors in the world at this meeting that I was at yesterday and Friday. And they talked very specifically about this 4-7-8 technique. So let's just do it. We're going to breathe in for 4, hold for 7, breathe out for 8. Let's do it again. Breathe in for 4. Hold for 7. Breathe out for 8. Okay, that's recommendation number 1. Recommendation number 2 is meditation and or mindfulness. And the way that I would explain this is that, have you ever flown over a thunderstorm? Like, I had a flight from San Francisco to New York JFK Airport when I was like 19 years old, flying by myself. And we flew for like 2 hours over this massive thunderstorm across the plains, and it was beautiful. You're looking out the window, that cloud would light up, and then that cloud would light up, and then this cloud would light up, and it was this beautiful storm. Well, that's what your brain looks like when it is functioning. Area lights up here, area lights up here, area lights up here. And so a technique like mindfulness, or doing a puzzle, or singing a song, or surfing, or what did somebody say yesterday? Crafting, of this very specific, intricate crafting. The goal here is to get those portions of your brain doing something other than paying attention to the pain, to paying attention to the stress. So Dr. Jason Kutch, who is one of the leading neuroscientists at USC, and we did an article on him and we interviewed him in our magazine a couple of years ago. He had a pretty serious pelvic injury when he was in grad school. He's one of those brilliant. His first degree is in mechanical engineering, and then he got a PhD in like applied mathematics, and now he's a neuroscientist. We're talking a brilliant person, brilliant knowledge-based person. So I asked him, so now he's had this big pelvic injury, so he has flares just like we do. And I said, what do you do when you have a flare? He said, it's really easy. I go to the beach and I surf. And I'm like, okay, I would never have thought of that. And I said, why? He goes, because when you're surfing, your brain cannot do anything but pay attention to the wind and the water and your weight. Your brain lights up specifically in that, just to keep you on a surfboard. And what happens is all the pain floats away. All the stress floats away. And I think that that's a really good lesson in pain science, that pain is ultimately controlled by your brain. And if we get your brain working on something else, the pain will go away. But the hard part is when you're the patient, you're like, don't tell me about that wacky, quacky mindfulness stuff. This is not all in my head. I have bladder pain. Give me something for my bladder. And it's like, listen, all the bladder nerves go up the spinal cord to the brain. And it's the brain that controls the pain response. So a target for reducing pain is the brain. Okay. The third thing that will calm the nerves down is what they call soothing touch. So getting a massage, having hugs. But here's something that we got at the conference. There is an app called Apollo Good Vibes. And there's a ton of research behind this. So when we think about the concept of soothing touch, that's a heartbeat. That's somebody rubbing up and down your arms, giving you a hug, right? It's a squeeze. that we can do that with vibration. That a certain type of vibration causes the brain to relax, just like it would with a hug. And it's basically doing the same thing. And so this is called, well, it's Apollo. And this is the Good Vibes app. So if I press play for 2 minutes, I know you can't hear this, but it's now vibrating, and it will vibrate and then it will stop. And see, it just stopped. It's a rhythmic vibration. Now it just started again. Now, honestly, I was listening to him going, oh, I don't know about this. And yet there's tons of research showing that this is safe and effective for a lot of different issues. And so I was like, he told us about the app. So I immediately downloaded it while he was talking. And then I used it. And it's freaky weird because it's soothing. It's like really soothing. It's calming. Like it's doing it right now. It's like, I don't even know how to describe it, except that it's like a happy hug. Anyway, this is free. You might as well, you got nothing to lose. I did ask him, I said, okay, what are the adverse events? He said none. The only people that might struggle is people who have it on for hours and hours and hours. That's going to then kind of overwhelm your nervous system, just like listening to loud music would overwhelm your nervous system. At some point in time, you got to turn it off and rest. So, okay, so that's something that could calm your nerves down. Movement, the importance of moving your body. Your body is not meant to sit in one spot. You gotta move it and use it. Music, nutrition, and of course, sleep. Good sleep calms nerves down. And as I said, I'm bringing on some new supplements. Here, hold on. Okay. So I've gotten to know a new company called Life Seasons Therapeutics, and one of the reasons why I've gotten to know them is I have a product idea that I want to pursue and invent because I have a goal. I want to own a patent. I had a great grandfather who had like 20 patents. And a lot of the supplements you guys are using today were actually my ideas. Or me talking with the companies about it, but I didn't get paid for them. So I have a couple of products in mind that I want to invent that I will own. Okay. Anyway, so this Life Season company, it turns out they have a really interesting sleep and anxiety line. So this is called Rest ZZZ Melatonin Free. It's designed to help patients who are struggling with sleep. It's got a little bit of magnesium, GABA, passion flower, lemon balm, which calms nerves down. It's not citrus lemon. It's a mint called lemon balm that has a proven nerve calming effect. And of course, our favorite chamomile, which we know has a smooth muscle relaxing effect, and a little valerian. So I thought, you know what? I wonder if this would be interesting for patients maybe to try this. I mean, this is new in the IC world, but I thought it'd be interesting. I have a Relieve RM, which is very similar to help with nighttime pain and discomfort. So that's very interesting. So it has white willow, angelica, L-carnitine, L-theanine, chamomile, lavender, lemon balm, GABA, and melatonin. And one other thing that I can't read because I don't have my reading glasses on. We've got these Rest ZZ oral strips that are melatonin based. So you dissolve them. And then the one I'm really excited about is because, again, for the widespread pain patient group where we know we're dealing with a lot of anxiety, they have some gummies to reduce anxiety. Very similar ingredients: GABA, ashwagandha, L-theanine, chamomile, lemon balm. No caffeine, nothing like that in this. So anyway, I will have these up on our website in our shop by the end of the week, hopefully. So Marlia, getting back to your question, I think the anxiety gummies would be a fascinating thing for you to try. You'll have to read about it when I get up. John said, I was told 20 years ago that I have a high riding bladder neck. I've wondered at times if that contributes to the pain. It might. Huh, that's really interesting. Is that from injury or maybe a birth defect? Did they give you any more insight into that? Marlia says, okay, Jill, this makes sense. Here's my plan. I used to train horses, only thrown once. I also have wiped out a few times my back in this beautiful upstate New York winter ice. I can actually feel my nerves inside me pulsating. I have a vibrating, stinging bowl somewhere. I can't get the vibration Apollo app because I have an Android. I'm going to drag out my singing bowl. So they have these bracelets you can wear that they based all their research studies on, but they're like $350. So that's why I think doing the app first is important, just to see if it would be helpful or not before spending that amount of money. Yeah, why not, girl? Why not? Music. You just got to light up your brain. And that might have been my dad's secret, because believe me, he had a lot of aches and pains for years because he was an athlete like I'm an athlete. But, he just did everything. It's just like, give me something to do, anything to do. And he would watch all sorts of videos. He would watch military videos. He would watch forestry videos. He would watch dance videos. He always had his big band music playing down in the man cave. I usually heard it echoing off the floor. And so I'm trying to listen to a lot of music myself. I tend to go for Hawaiian music on my Alexa. I just say, Alexa, play Hawaiian music, and I tend to have that going on in the background all day. But the boys are back. I'm Army. I love BTS. And I love listening to BTS. They make me very, very happy. I was very happy to see them leave the military this week. I look at them as grandkids. So RM and V and Jimin and Jungkook are out. We're just waiting for Suga in 10 days. And then the group is back. And hopefully we'll have some new music. Hardest working band ever, I think. I just love BTS. And I love their message, because their message is one of being kind and comforting to other people. And I really like them. Kate says, masses of information. Many thanks. You're very welcome, Kate. Always happy. Always, always happy. Yeah, so I just had a big giant. I have a BTS sweatshirt. I do. And I was just wearing it in support this week, waiting for them to come out. And I'm so happy they're out. Yes, I'm in my 60s and I like K-pop. I'm sorry, I do. It's silly, but it works. All right, guys. Well, listen, any more questions? It's Father's Day. You got to go have dinner with your dad or call your dad, do all that sort of good stuff. If your dad is here, if not, tell a funny story about your dad. All right. Well, I think we're done. So I will see you next week. Knock on wood. Marlia says, love Hawaiian music too. You must listen to the big guy whose name starts with a K. Long name. Oh yeah, man, that song is just so good. Somewhere. It is Apollo. Here, hold on. Let me look at Apollo, like the god, or like the space program Apollo. So the app is called Apollo, and here it is right here. Whoops. Right there, Apollo. Apollo. And when you open it up, so there's a free version and then there's a paid version. The paid version is $90 a year, and you get extended playtime, shareable vibes, and programs. The app is a little bit challenging to navigate, I'm going to say right now. Like, you can always tell when doctors make things rather than app programmers make things. So like, it is forcing me to start. Okay. Yeah, I can't, okay, no. So when you get to the free trial part, if you just scroll down, it'll take you to the pink page. So you're not even signing up for anything. I'm fascinated. As they say, stay grounded and fully present. This is your good day. And in the end, they were really talking about how important it is that you not live in the pain and you not mentally dwell on the pain. You've got to be focused on how you want to live your life, what you want. We've got to start turning that central nervous system away from pain and fear into promise and hope. And the biggest message they left, these doctors at this conference, is you always give your patients hope. They must have hope. So anyway, that this can be treated and they can have a life again. All right, guys. I'm going to say goodbye to YouTube first. Bye, YouTube. Be well. If my mouse worked. There it is. This is the mouse I've got to put on my jeans. Bye, YouTube.